Hello, I am Melissa Dufer with Nash Community College, English 112, presenting the controlled efforts to understand cystic fibrosis and increase life expectancy. Cystic fibrosis is a life-altering and threatening disease that affects the lungs and causes thickening of the mucus glands in the exocrine system. Over time, it causes difficulties in breathing and digesting food. Medical advances have come a long way in the last 2 decades. The improvements in therapies and drugs have increased the life expectancy of patients to over 40 years old, whereas it was just once months old. The population of patients with cystic fibrosis has grown tremendously. Although there is no cure for the disease, successful therapy procedures are available, combined with medicine, exercise, and nutrition. Cystic fibrosis is a mutation of the gene that encrypts a chloride-conducting channel called the cystic fibrosis transmembrane regulator, also known as CFTR. Both the mother and father of the patient have to be a carrier of the disease to have a child with cystic fibrosis. If only one parent is a carrier, the child will not have the disease, but may be a carrier. If both parents carry the gene, there's a 25% chance the child will have cystic fibrosis and a 50% chance their child will be a carrier of the disease. There are cystic fibrosis clinics all over the nation that specializes in the disease. The patient needs to be cared for from the time of infancy through their lives to help the patient gain control of the disease. General practitioners don't have the advancement and knowledge on the disease as the specialists at the clinics do. It is critical the patient's family and caretakers understand the disease and follow daily regimens to ensure the patient's best medical care for longer survival. There are many new treatment strategies for the patients and trials. Steps in targeting these strategies include gene therapy, proteins, rehydration of the airway surface, anti-inflammatories, and anti-infective agents. Granted, all strides being made are currently unavailable, but advances are being made every day and only going forward. Inhalers, antibiotics, vitamins, and nutritional supplements are necessary in care for control of breathing and food digestion. The families are affected as well as the patient. Missed work, education, specialty clinics are not very easily accessible from home. Family must be cautious of household and environment pollutants. Families may feel more secure finding a clinic to care for their patient. Unfortunately, there are few available and may be very far from home. Caring for the patient takes a lot of time away from daily routines, such as work or school. The patient requires much more attention, especially when they become sick. Patients may spend days hospitalized due to infections or complications from the disease, again, causing many hours of involvement. Proper care, medicines, clinic, and hospital visits may become very costly to the families and may hurt or suffer. Dirt, mold, pets, and many other allergens play a significant role to harm in a patient with cystic fibrosis. It is very important that the area that these children are around stays clean and healthy. Antibacterial is always available. Medical advances are being made every day. Unfortunately, lung transplants is the only cure as of right now to cure cystic fibrosis. The cystic fibrosis survival has improved from 2000 to 2010 at a rate of 1.8% each year. Newborn screening started in the 1980s and became routine in the 1990s. About 90% of cystic fibrosis patients will die without a lung transplant. Currently, the only cure for cystic fibrosis is a lung transplant, which will add years to the patient's life. Articles by Danny Buckland prove that early detection empowers patients, improving quality of life and management of the disease. Buckland focuses on early detection of cystic fibrosis and how to care for the patient at a young age. Newborn screening is crucial for the disease and efforts to become knowledgeable. Newborn screening started in the U.S. in the 1980s and became much more popular in the 1990s. Thank you for taking the time to learn about cystic fibrosis. It is a disease that medical teams are constantly striving on making advances in. I hope you have taken in a lot of information on the disease and understand the importance of the research medical teams are doing and the care that the families need to endure for their patients.